Thank you, Mr. Speaker. Mr. Speaker, the primary care situation in this province is becoming desperate. Nova Scotia Health says that of the 12 family doctors in the province who've resigned in the last 14 months, with a combined caseload of 13,600 patients, one vacancy has been filled. Last week, when asked about the shortage of family doctors, the Premier said, as the world changes, the healthcare system has to change. Mr. Speaker, people need primary care that they can count on, and this government has left them waiting. Is this the kind of change that the Premier had in mind?
The Honourable Premier.
Thank you, Mr. Speaker. I certainly don't know about the number of statistics. I do know that we've recruited, 148 doctors this year. That's a net gain of 74, in the range of 74, Mr. Speaker. We know that there are issues with retirements. We know we have to be respectful of those that have been providing care to their communities that want to retire. They should be allowed to retire, Mr. Speaker, without making feel guilty about retiring. What I would say to the member is the change we're talking about is the evolving world about how people access care. We're talking about virtual care now. That's something new, wouldn't have been talked about, certainly not under the prior government, 5-10 years. This is the way the world is changing. Mobile clinics, pharmacy clinics, these are all positive changes, Mr. Speaker. There's a lot of work to be done, Mr. Speaker.
The Honourable Leader of the New Democratic Party on her first supplementary.
Last week, the Premier also said the old days where you had a doctor when you were born and there was a doctor through your life who delivered your children are over. We need to move forward and accept that the world is changing, and we agree. We believe that all Nova Scotians should have a family practice, a place they can call for an appointment for medical advice, where their file lives and is followed and updated, a collaborative health team. But investment in these teams in this budget is paltry compared to the need. So, Mr. Speaker, will the Premier commit to ensuring that all Nova Scotians without consistent care get access to a family health team they can count on?
The Honourable Premier.
That's certainly the goal in Nova Scotia, Mr. Speaker. It was the goal I heard on the campaign trail in PEI. It's the goal of all Canadians. We know that the evolution is towards, it is away from that family doctor you had your entire life. The world is changing. We have to accept that. We can't fight that, Mr. Speaker. It is evolving towards a health home. Yes, absolutely, where you are part of a health home and you get the care you need at that time. It might be a doctor, it might be a nurse practitioner, it could be a physician's assistant, it could be a registered nurse, it could be a family practitioner, Mr. Speaker, it could be a psychologist, Mr. Speaker. But yeah, absolutely, Mr. Speaker, we want Nova Scotians to have care. That's why we're in this position, Mr. Speaker, is to make sure we fix health care.
The Honourable Leader of the New Democratic Party on her final supplementary.
And yet we don't hear this government talk about these health homes. Mr. Speaker, last week the Premier also said virtual care is not for everything, but it's just what the doctor ordered for a number of things. Virtual care has a place in healthcare, but it is not what the doctor ordered for someone who needs their medication adjusted, someone with a cancer diagnosis, someone with a complicated pregnancy. These people need a family health team that can follow their condition. But this government has not invested in making that happen and barely mentions it. Mr. Speaker, will the Premier commit to having an access to a family health team for all Nova Scotians by 2025?
The Honourable Premier.
Mr. Speaker, I don't know if we're now debating the merits of the role of virtual care or not, Mr. Speaker, but I would stand very firmly in my place and say there is a role for virtual care. There is a role for pharmacy clinics. There is a role for mobile clinics. There is a role for the spectrum of allied healthcare professionals. That's why we want to expand their scope. That's why we want to work with them and give them an opportunity to be here. Mr. Speaker, if the member didn't hear talk about health home, I think that the Minister of Health stood in this chamber for 20 hours answering questions. If they didn't hear about it, it's because they didn't ask, Mr. Speaker.